It is now just shy of 2 years since my private member's bill, the Carers Leave Act, received Royal Assent, and a little over a year since the necessary regulations passed to enact the legislation. And this came after years of work by dedicated campaigners in Parliament and without. And I had the pleasure of meeting some of them at an event to celebrate the law passing, and said then what I say now, which is that by passing this bill, I am standing very much on the shoulders of many, many who came before. But the job isn't done just because the law is passed. Employment rights are only useful if they're known about, enforceable, and are solving the intended policy issue they intend to do. That is what I want to use this debate for today, to look at how the work has been, how the law has been working for unpaid carers over the past year. Because, Mr Stringer, as much as I wish it was, as politicians I think we all wish it was, the myriad of problems and hurdles faced by unpaid carers, or indeed anyone, is not solved by the magic of one private member's bill. And according to the latest census data from all 4 nations, there are at least 5.8 million people in the UK providing unpaid care for an ill, older or disabled family member or friend. And of these, 2.8 million were recorded as balancing that caring responsibility with work. We estimate that the value of the support that unpaid carers give to our economy equates to over £160 billion per year. That's to say that our care force is massive and it needs valuing and supporting alongside every other industry. But we also know, and members have already touched upon it, that statistically being an unpaid carer makes you worse off. And earlier this year I hosted a policy breakfast with the Centre for Care at Sheffield University. And although the Minister couldn't attend, I'm grateful to the Department for Business and Trade and indeed the Department for Health and Social Care for sending civil service representatives. As we heard then, the Centre for Care have been doing some very important research on the impact of being an unpaid carer on income, which was published last year. And staggeringly, it finds an average relative income gap of up to 45% for those informal carers providing the most hours of care. And I do recommend to the Minister that he read the research. It is quite heavy on the statistical analysis, but I'm sure the Centre for Care would be happy to meet with him if they haven't done so already. And this academic research, Mr Stringer, confirms what we already know from the surveys carried out by organisations such as Carers UK. That unpaid carers are more likely to live in poverty, and that doing something altruistic for the people you love makes you worse off. The State of Caring survey carried out by Carers UK for 2024 found that 40% of respondents had had to give up work, finding the juggle unmanageable, and those of them still in employment, 44% had either reduced their working hours and a quarter had moved to a more junior role. And that leaves the vast majority of unpaid carers with less money in their pockets every month. And at a time when, particularly if they're living with the person they care for, and we know there is a significant disability price tag. PIP down here, but the adult disability payment, now a devolved benefit in Scotland, are vital but not enough to make up that difference. And it's very important to note that this isn't just about immediate poverty, although that is a very real issue. It's also about tackling poverty amongst pensioners, especially women, who are still more likely to be unpaid carers and are more likely to subsequently reduce or stop working as a result. We have a gender pension gap because we have a gender pay gap. And the latest government data sets that gender pension gap at 35%, but other organisations put it at much higher. And we know that caring plays a large part of that. And over 2/3 of carers responding to Carers UK last year who had given up work said that they were worried about managing in the future, whilst over half who'd reduced their hours said they'd cut back on savings for their retirement. All of this matters, Mr Stringer, not just to the individuals and their families who are struggling or to those who have promising careers that never reach their potential, but to this government who need to respond to the rising rates of poverty amongst older people whilst trying to reduce the benefits bill. But Mr Stringer, the struggles which lead to people stepping back from work are entirely understandable. Caring is hard, it is tiring, it is stressful, it is time-consuming, and it doesn't neatly fit into our 3 hours of the day. And flexible working does make up some of that picture, and I'm sure the Minister will acknowledge that in his remarks. But there will always be pinch moments where care arrangements need changing, extra hospital appointments need attending, or where all the tiny acts of care and admin for your loved one just cannot be fitted in and around work. Where the risk is that people use up their holiday, something which all the evidence tells us is bad for their own health, and refers to the Honourable Member's intervention in relation to respite. And that is what the Carers Leave Act was aimed at solving, or at the very least helping with. The first legal right for carers to take leave for work for caring. an acknowledgement of how hard it can be, and to prompt and start a conversation about support in employment. So the question is this working 1 year on? What do we know, Mr Stringer, so far? It is clearly far too early to see an impact on poverty or even net employment rates, and I don't think the legislation that was passed is significant enough to do that. Even if we had the statistics available, there are too many moving parts to isolate cause and effect. But I hope we should be getting a feeling by now is on how well advice on carers' leave is being communicated by the government to businesses. Whether businesses are updating their policies and their systems for requesting and recording leave. Are they training their managers? Do employees know about their rights? Would they feel comfortable in using them? Is the dial being moved at all towards more carer-friendly workplaces? And my big worry in the first few months after the regulations passed was that the government was not doing enough to tell businesses about the new rights and what was required of them. And I will accept at that time we obviously had a general election and a new government. But for too long, the main advice on gov.uk was on a web page for new businesses setting up for the first time. And I'm happy that that seems to be remedied, because if you now use the search engine to look for carers' leave, the right page will pop up. But I'm less comforted by the lack of resources on carers' leave, or indeed unpaid carers at all, on the Department for Business and Trade's actual website. My team yesterday searched for carers' leave under guidance and regulation and found no results. Under research and statistics, no results. Under policy papers and consultations, 1 result, and under News 3, 2 of which was from when the law itself was passed 2 years ago. Indeed, it appears that the only interest that this government thinks it has in carers' leave is announcing a review into how it is working. Now, clearly, given this debate, I'm happy to see how things are going and how we can improve them. But I would venture to say that the government risks abandoning the responsibilities to working carers by not taking an interest in promoting the leave that is available right now. What are they doing to make sure that businesses, big and small, know about the rights of their employers and are supported in implementing them? How is this getting out to business owners and busy managers who simply don't have the time to look up a right they might not even know exists? The Department for Business with the Treasury has more power to reach companies than any other organisation. If the review finds later this year that companies didn't know about the leave and therefore it's been ineffectual, then DBT will need to look at its own failings for not doing more. And in addition, I would add that enforcement of legal rights is not the only way the Department could be encouraging carer-friendly workplaces. Businesses could be encouraged or signposted to a whole range of resources, including guidance from the CIPD and the Employers for Carers network. Carer Positive in Scotland is done with the Scottish Government. I'm pleased to say that my own office is a Carer Positive employer, and there is no reason why similar initiatives couldn't at least be encouraged down here. And as to what's happening with businesses, we can get something of a snapshot from an employer survey report published by Carers UK in January this year. And I say only something of a snapshot for one big reason. The employers answering the surveys are ones already tapped into their networks, already alive to the issues facing carers. So low levels of reform could indicate less reform needed because existing policies were already in place, whereas high improvements could be because the self-selecting group is motivated to go above and beyond. But there are some really promising findings in the responses. Almost 90% of responding organisations reported no challenges in implementing the Act. Over half of a dedicated carers' leave policy compared to less than a quarter before the legislation came in. 23% of organisations have seen an increase in uptake of their internal networks or support groups for employers. Many responded in free text that the law change has prompted greater understanding about what it means to be a carer and how people can move in and out of that status. But there are a number of factors, Mr Stringer, I'm worried about, which the government should be worried about and should be looking at fixing now, immediately, as well as within its longer review. Only 3/4 of organisations, remembering these are ones more likely to take action, had told their employees at all about the new right. And this tallies with other research, which has found that only 2/3 of working carers know about carers' leave at all. We need to bear in mind that hundreds of people become carers every day, and most people aren't paying attention on the intranet or in their work emails to things that aren't relevant to them. So unless that information is easily accessible and reiterated regularly, the chances are that salience amongst working carers will continue to go down as time passes. And even for those employees who know about the right, there is a reluctance reported still to be open about caring responsibilities or to request time off. 15% of respondents to the State of Caring survey said that they were worried about a negative reaction to taking time off for caring. And deeply worrying, some respondents said that even though their organisations had policies in place, their own line managers blocked requests for support. And we should never be hearing reports like, "I work for a large public sector organisation. How you're treated all depends on that one single manager." Or, "My employer offers flexible working, but my line manager doesn't and says carer leave is for emergencies only," which it isn't. Given the integral need for line managers to actually implement carer-friendly policies, it's vital that businesses offer internal training and guidance. And it's therefore worrying that responding organisations to the survey on carers leave, only a quarter of those had specifically raised awareness or provided training to managers in implementing that right to leave. If the kind of organisations who are already tapped in to carer-positive networks aren't doing this, then it is not hard to imagine what is happening in areas where there is low support for carers. There is a place for the government here to make sure that rights for working carers are a reality, not just a piece of paper. Finally, Mr Stringer, there is the elephant in the room of paid carers leave, which has already been referred to, and whether people can afford to take the time off. And I've always said that I want to see the legislation amended and upgraded. And I served with the Minister for Employment Rights and delegated legislation, considering the then draft carers leave regulations last year, and I recall that he too wanted to see it paid, and he might want to reflect on his own frustrations with how long it took to see this law through, and ensure that we don't see the can on paid leave kicked down the road. But I'll leave that to colleagues to look to the future. But today I urge the Government to take the steps so the law we have currently, the Carers Leave Act 2023, can reach its potential, be known about, talked about and accepted in our workplaces, and sparking conversations on what it means to be a carer and how work can be made to work for the unpaid carers that we all rely on. Thank you.